the amazing thing is that gets rid of the Tower of Babel, and it says if someone in another country decides to run an epilepsy trial on young people with epilepsy, they've got that core outcome set, so we can start to compare apples with apples, which is a really big step forward, which we're kind of really proud of.
Fellow Homo sapiens, welcome to or welcome back to Epilepsy Sparks Insights. Now, sleep is more than a big deal. It is a huge deal for our species, but for individuals and families affected by the epilepsies, the impact of not enough or of poor quality sleep can be even more significant. This week, in anticipation of the Changing Agendas on Childhood Epilepsy Management Conference in July this year, 2024, we get a peek into the cool Paediatric Epilepsy and Sleep Research Project itself, called CASTLE, with leads Deb Powell and Paul Gringras from King's College London.
I'm Paul Gringras. I kind of specialise in paediatric sleep, both clinical and research in that domain, and I've been doing it for kind of many, many years. And the really interesting thing is that there's a nice intersection between sleep and seizures and epilepsy, and we never know whether it's chicken or egg what's caused it. So we've then had this fantastic opportunity to work through a research project together with Deb, who's a mate from many years ago.
Deb, tell us about yourself then. What's the link between you two? What's the gossip? Do you know stuff about each other?
Well, I don't know if we have long enough for all of that, but it's great to be on your famous podcast. So I'm a professor of epilepsy at King's College London, and I'm also a consultant paediatric neurologist. And as Paul said, we've known each other for quite a while. I work in epilepsy, he works in sleep. Why don't we do something together? That's what we thought about 7-8 years ago. And so that's, how the CASTLE project got started.
Well, I can say as a person with an epilepsy, thank goodness we have you guys, because many of us have been kind of aware, and many other clinicians, of the link between sleep and seizures and all the other lovely shebang that comes inside one's brain. So this is brilliant stuff. And so you have a conference coming up.
Yes, that's right. Up in Manchester at a very, very beautiful venue, the Whitworth Art Gallery. So we're taking over the entire gallery for the whole day, and it's going to be open late at night till 9 o'clock. So, there'll be music and dancing maybe, I don't know, but a lot of art anyway.
And what's the purpose of this? Are you trying to introduce this link and your work together at this conference? What's the content?
Well, this is the culmination of our 7-year NIHR research program. We've covered a lot of ground over those years. Obviously, we had a little break for COVID. Paul, do you want to talk about the different projects in CASTLE?
Yeah, as Deb said, that this is really our chance to do the most important bit with any research project, which is to disseminate it, to spread, what we've learned, and indeed to share what we haven't learned as well. The unanswered questions. The main thrust of CASTLE was to think outside the box and to not just count the number of seizures, which is what a lot of trials have done previously, because in fact there are many other aspects of learning, attention, and sleep that are equally, if not more important. And so we've really been privileged to work with patients, so both children and young people with epilepsy and with their parents, and with an expert advisory panel with adults with epilepsy. So every step of the way, if we've kind of happened on a question, that's been co-created. It's not just been what we think is valuable as researchers. And indeed, even before running some of the actual studies and some of the trials, they've been totally co-created, because otherwise it doesn't work. The concept of a professional designing an app to help parents manage the sleep of children with epilepsy, if you don't involve children with epilepsy and parents, it ain't going to work. But we have designed one. That's just one part of the many themes we've done.
What's it called, the app? Can we access it?
The app is called COSI, CASTLE Online Sleep Intervention.
Oh, COSI with an I then, yeah.
Yeah, so in short, you can't access it yet because the whole idea is that half the people on the study have had access to COSI, and half of them have just had kind of what we call treatment as usual. And so it's quite important until we finish that it's not out there. And also, we need to know what bits work well and what bits need tweaking. So for all those reasons, not yet, but we are looking for advice and support in how we can next build the next iteration.
Oh, fabulous. Because there are so many apps out there. And to be honest, the majority are probably not overly great. And so it is kind of important to get the target market, shall we say, to approve.
You're right, Torie. I mean, the main problem is, yes, there are a lot of sleep apps out there, but very few, if any, are evidence-based. So this is the first one, I think, with clinical trial evidence, and the first one for children, for young people.
I mean, of course, it's targeted at children and young people, but, will the elderly be able to use it as well, or older people?
Well, the way we've designed it, because of the age group, the age range, children, of course, are not very good at managing their own sleep, and they usually have parents or older adults looking after them. So the way we designed COSI with our advisory group was a sort of online training platform for parents, and they go through sort of modular format. And there's a filter to begin with where the parent selects the sort of issues that they're having with their child's sleep behavior, whether it's, difficulty in trying to fall asleep or waking up in the middle of the night or whatever. So you select the problems that you're having issues with, and then you're presented with a series of modules that you can go through yourself at your own pace, and there's some sort of self-assessment questions and so on, and lots of features and input from young people and their parents, cartoons and videos. And for that reason, it's through the parents rather than directly to the young people themselves, because we want to keep them off their phones in the morning.
Gosh, well, yes, especially talking about sleep, hey. And so I suppose because it's well targeted, it's not like a competition for how many acronyms can we get inside each word or anything like that. It's in layman's terms, I hope, yeah?
Totally child friendly, yeah.
Back to this conference, what's the layout? Who's going to be talking? What are you going to share with us that you're not sharing already on this podcast?
I heard, Paul, that there are a couple of football teams up there. I don't know if you've heard about them.
I can't show any bias, even though I come from Manchester and I'm suffering a lot of pain at the moment, so you can guess which team I support. I mean, the people who will be talking are the heads of each of the work package. So the way we conceptualize it's a very big grant, but you have to chop it up into individual components that all link up, and together they're more than this. They're more than the sum. And so each work package, one of them was to say, what are the really important outcomes other than just counting seizures that matter most for people with seizures? First time it's been done anywhere in the world, and there's a very set way of doing it, and there were kind of 10 key outcomes. It's all been published. And the amazing thing is that gets rid of the Tower of Babel, and it says if someone in another country decides to run an epilepsy trial on young people with epilepsy, they've got that core outcome set, so we can start to compare apples with apples, which is a really big step forward, which we're kind of really proud of.
Yeah, and that core outcome set was created by all the stakeholders, so young people, parents, and health professionals. So we went through a Delphi process, and now we've got that core outcome set. But that sort of priority setting activity is something that the Epilepsy Research Institute recently did as well. I'm sure you and your audience knows all about that. We did it first, I think, a few years ago with young people.
Of course you did it first. The best of the best. So there aren't any sort of numbers you can give us? Any sort of results of your study so far, just to ping out there?
Well, that would be a spoiler, a true spoiler.
Oh, you really are not allowed to give me anything. Okay, cool.
We don't know either, do we, Paul?
We don't, but there are some things that we can share. So one of the fascinating things was, obviously, it's one thing to have an app, to have any intervention, but how do you measure it? Do you just ask the parent how the child slept, or do you do something more sophisticated? And what we've done, I think, is kind of, again, really groundbreaking. So first of all, the child wore a device called an ActiWatch, which is like an expensive Fitbit, which enables us over a period of a week to really analyze what their sleep patterns are like, how much it's getting chopped up, and things like that. But we also got the main caregiver to wear it as well, because what about the impact it's having? And most of the time that's the mum for various reasons. But so they wore it as well. And then we even did a little test of learning overnight. So many years ago, Deb and I designed this iPad kind of set of games, which feels like a game when a child does it, but it's measuring things like reaction time, learning particular words, all the type of stuff that gets jumbled if you don't have a good night's sleep. And so we've done this across the sample. So we've looked in so many different ways, further than just the usual questionnaire, and it might be, we've done some studies before where, in fact, the impact on the young person has been harder to measure, but the impact on the parents is they're less tired, they're less likely to crash the car on the way to work.
That's good.
And really important outcomes indeed. And one of the groups was a qualitative group asking parents how it all felt. And so, again, that information is out there, and it's been incredibly well received. And people have gone through the questionnaire. And so we've got not just the outcome of data, but we've got people's words, people's description, lived experience of how it's been to be in part of the trial, what it's been like to do it. And it's all been thumbs up. And the main kind of outcome kind of questionnaire, everybody did. We can tell you the numbers of people who took part, can't we, Deb? But I'm going to hand that over to Deb in case I get it wrong.
Well, yes, we both should have a head for numbers. I think somewhere north of 90 participants were in the trial.
Cool. And over what period of time was it?
It took us about a couple of years to recruit. We had about somewhere close to 40 sites across the UK.
And included was a sort of a relatively decent diversity of people included?
I would say so. I mean, given the sites, yes. Obviously, we'll have the ethnicity data in the final results, but yes, every place you can think of up and down the country.
Brill. And I like that you mentioned, Paul, the qualitative research, because I think that's so important and often left out when it comes to epilepsy research. Like, I've had people say to me, oh, yeah, but mate, that's not very easy. It's not a digit. And I'm like, well, darling, I know. But when talking about quality of life and, trying to understand how fellow Homo sapiens feel, it's kind of important, right?
Well, so as part of it, what the qualitative kind of crew did is they interviewed parents about where they thought their meetings with professionals had left them with questions unanswered, what they thought about capacity. And at the same time, to be fair, we did surveys of professionals, pediatricians that see children with epilepsy, to say, what are the barriers for you? What are the knowledge? I mean, the actual knowledge and the input about sleep is like negligible. And it really is. The epilepsy nurses are fantastic, but are much more constrained for time. So we do get the usual story a bit about resources. And one of the questions we're asking ourselves is, can we help that process? If we can provide something that's online, that can be a shared experience, then maybe that will be a way to facilitate and make life easier for the professionals who've got all these difficult things they need to discuss and empower the families with, but don't always have the time to do it.
We know that in many people with an epilepsy, children included, poor sleep can be a seizure trigger, right? And I've often thought, and I've said to lots of people actually, look, maybe you don't need to be looking at just the drugs that you give to children or, humans. Actually, how about preventative measures? And do you think that's potentially something taken from this research or something to be learnt?
Yeah, no doubt. I mean, there's so many factors contributing to sleep disturbance. No two families are the same. So, yeah, we need to take a slightly personalised approach to this. Yeah.
So, if anybody's interested in coming, are we saying no to anybody? I mean, obviously, your ideal guest?
I think our main audience is probably going to be people who care for or manage young people with epilepsy. So we've invited all the people who took part in the research, the sites, the nurses, specialist nurses, the paediatrician, and so on. We've got most of the advisory panel coming. Our advisory panel is about 25 people. So many of them are coming, so young parents, people with lived experience, and so on. And we've got the patient organizations too. Epilepsy Research Institute, Epilepsy Action, and the professional organizations. So Royal College of Pediatrics, the British Paediatric Neurology Association, Epilepsy Specialist Nurses Association. And we're trying to get along as many people who've been on this road as possible, in terms of developing an intervention and then going along the road to translation, to bring it into the NHS, to scale it up for the whole country. How do you do that in a way that's sustainable and economical, preferably free?
Thank you to Deb and Paul for such a fun chat and for giving us a tease of what the Changing Agendas on Childhood Epilepsy Management Conference in July 2024 shall hold. If you are a clinician caring for young people with an epilepsy, and if you're interested in attending the conference where you can meet the podcast star guests, the clinicians who took part in the research, the advisory panel, and the other bodies aforementioned, then do contact us through the links below or via our X accounts, Pal Neurolab, Torie Robinson 10, or Epilepsy Sparks. You can see the links in the text below this recording too. If you haven't already, don't forget to like, comment, and subscribe to the channel, share this episode with your friends and colleagues, and see you next week.